Hi, I'm Katie Ziskind. I'm the practice owner here at Wisdom Within Counseling in Niantic, Connecticut, where we specialize with adolescents and teens who need confidence, self-esteem, and positive coping skills to handle negative feelings in healthy, productive, and positive ways. You can learn more about us. You can reach us online. Head on over to wisdomwithinct.com. I wanted to talk about teen self-harm. Self-harm is something that a lot of teenagers and adolescents will do when they're having a feeling that's overwhelming. It's unmanageable. It might even be a new feeling because your adolescent's brain is developing. That frontal lobe, that medial prefrontal cortex, this first part of the brain, this is the emotional center. Hi, Ian. How's your yoga practice going? So self-harm in teens is something that's a really important issue to nip in the bud. Just like picky food behaviors can turn easily into anorexia or an eating disorder, if your teen is having anger, it can quickly turn to a negative coping outlet. Self-harm is your teenager's way of communicating that they need help. They need help processing emotions, and they can't actually verbalize this to you. Hi, Elizabeth. How's everything going with your practice? Self-harm is very prevalent, and it's also something that if your teenager doesn't have a coping skill toolbox and a friend is self-harming, your teenager might get curious and try self-harming. So it's very important to have your teen in therapy as a preventative measure to process when other friends and peers are making negative decisions, but also to learn different outlets such as going for a walk and talk session and processing that anger in a healthy alternative way. So self-harm can start off as just small scrapes and cuts. When a teenager self-harms, their body will actually have a boost of feel-good chemicals. So just like when you work out, you feel so good afterwards, or you go for a run, you have this boost of endorphins. Cutting actually does the same exact thing. Your body produces kind of these soothing, pain-relieving hormones. So what we do with teens is we teach them alternative, other healthy ways to release those same feel-good chemicals. So you get a boost of serotonin every time you eat a nourishing meal. Sometimes teenagers who go all day without eating will be really moody and sad and even self-harm to try to get those chemicals in their brain again. So making sure your teenager has really good nutrition, can have eating good meals, feels safe and comfortable eating at school. Oftentimes, teenagers will develop co-occurring issues like eating disorders alongside self-harm, might even be skipping class. So having your teenager in therapy can help your teen deal with family issues such as divorce, blending families. If you're a parent, you're getting remarried, if you're moving and your teen has to change high schools, or even loss of a grandparent, or if their grandparent has been diagnosed with a health issue. These can all be really big stressors on a teenager, let alone sexuality, dating, creating healthy boundaries and relationships. So oftentimes, teens need support when they're self-harming. Self-harm is a red flag. It's a behavior that will not go away on its own. Your teen will not stop self-harming without treatment. Your teen will probably be concealing self-harm at first. So one way that you can tell if your teen is self-harming is if you notice light bulbs missing, if you notice razor blades missing, if you are noticing your teen is wearing long sleeves and long pants in the summer months when normally they just wear shorts and a tank top, your teen is hiding. And so you really also want to jump on these behaviors, get your teen in specialized expert teen help. We are a team that works with self-harm on a daily basis. We communicate with hospitals, with other therapists, with eating disorder clinicians, with nutritionists. We try to get the whole team, pediatricians, involved. But we really provide teenagers with confidence, with clarity to speak up, to be able to express emotions, and be able to really feel confident handling all emotions, whether it's anger, loss, sadness. Hi, Pat. How's it going? So we work with teens that self-harm, and we help them find other outlets and alternatives to self-harm, because your teenager probably has a lot of guilt or has a lot of anger around changing family issues and needs outlets and needs tools. So we offer creative art therapy and outdoor walking sessions and guided, relaxing, rejuvenating meditations to promote inner peace. And to help teens harness their own inner wisdom and help teenagers really develop a strong moral compass, a sense of inner techniques, a sense of a toolbox to say, okay, I can use walking today, or I can use my guided meditation to fall asleep, or my girlfriend just broke up with me and now I can paint and let out my feelings with painting or glitter or making something right in session. And that gives a teenager a sense of accomplishment, a sense of leadership, control in their ever-changing lives again. And this is how we help teens stop self-harming. Because if you take away self-harm, it's only going to lead to another coping skill that's negative, unless your teenager has a guide, a professional mental health teen therapist, to teach them other outlets, to offer skills. Just like your teenager would take math, science, or algebra, your teenager is going to be coming to therapy and benefiting, learning about emotional expression, how to socialize and make good friends, how to identify when a friend isn't healthy anymore, how to break up with someone without having to stay in the relationship that you don't want, how to be direct and respectful around really tough emotions. And we also offer parent support sessions because we know for parents that have a teen who is self-harming or cutting, it can be really concerning. You can be concerned about multiple issues. Maybe you found alcohol stolen from your alcohol cabinet. You have gone into your teen's bedroom at midnight and the window's open and they've crawled out the window. Your teen has snuck smoking cigarettes or is maybe smoking marijuana. Your teen might have been suspended from school or so anxious about drama at school that they're refusing to go and they're just laying in their bed and sleeping in. Teenagers show you their feelings and ask for help without directly talking about it. Of course, sometimes your teenager might say, yeah, I'm really worried about the SATs coming up. I need to process my anxiety with a therapist. But oftentimes teenagers who can't talk about it will show you through negative behaviors such as self-harm, eating disorders, binging, restricting, or purging with food, even sneaking out, doing these negative things. It's really a way of them saying, I need help. I need someone to talk to about issues. I need techniques and skills. So we offer mindfulness, real-world mindfulness that your teen can apply into school environments to be able to sit through the day, to be able to get through negative emotions. If a teacher causes anger, causes frustration, your teenager can then get through that feeling to graduate high school and to go to college. So your young adult then can be successful emotionally, stable emotionally, and confident emotionally for independent living. So as a parent, you can feel confident that your teen is going to be okay going off to college. And you're not going to have to drive to your teenager's college dorm every morning to make sure they get up, or to make sure you're doing a safety check to make sure they're not self-harming. So we love helping to prepare teenagers emotionally for college life, for independent living. We work so frequently with self-harm, eating disorders, teens who have high energy that need to go outside and just gain positive coping skills to be confident emotionally and to be able to think clearly. So your teen doesn't have to be impulsive and act out of guilt. Your teen can have a layer of self-awareness and be able to observe their emotions without reacting right to them. And we teach teens these skills to be a wise owl, to sit back on that tree branch and observe without jumping right on that emotion or jumping out and lashing out in anger at a teacher when maybe that's going to have some repercussions on your grades. So we love working with teens and we love helping them love life, believe in themselves, recognize their own unique talents, their own creative strengths that make them different. And we really try to remind teens that, they're making a big impact on this world, and to help them kind of find that sense of rewarding feeling, that sense of leadership, that sense of ability. How can they really create a life that they love, that they enjoy? Can they create a partnership, a friendship that they really feel good about? So we teach a lot of lifestyle changes, from sleeping changes, nutrition changes, and coping skills overall to help teens stop self-harming and instead choose self-love. You can read more about how we help teens stop self-harming over at wisdomwithinct.com. You can also call us for a 30-minute phone consultation, which we like to get scheduled in advance, where we can hear more about your goals for your self-harming teenager, where you want them to be, some of their current struggles, things that have not worked in the past before, and to see how we can help them really tackle self-harm and learn confidence. You can call us. We only have a few spaces left available. Call us at 860-451-9364. You can also send us a text as well to get that phone consultation scheduled about teen confidence and to have a teen who is confident releasing and expressing emotions from anger to sadness to anxiety. And I'm Katie Ziskind, the practice owner of Wisdom Within Counseling in Niantic, Connecticut. We're right next to Smith Acres Flower Shop and across the street from Niantic Center School, the old fish school, even though there are no giant fish on the school anymore. And we're a team of 5 therapists, open 7 days of the week. We would love to help support your adolescent or your teen in terms of emotional confidence, bettering self-esteem, and helping your adolescent or teen create meaningful, healthy friendships. Have a great day.